It's time for Around the Ozarks Sports Scene, brought to you by Fast Break Sports, the largest selection of cards and card supplies in Southwest Missouri. Now here's your host, Scott Puryear.
Welcome to Around the Ozarks Sports Scene. I am Scott Puryear. I want to thank you again for listening to our podcast this week. Got a guest taking a little different turn today. We're going to talk sports injuries with Dr. Heath Melugin. But first, we always start off with our look ahead to what to watch in the Ozarks sports scene this week, and it's finally here, Super Bowl week. Of course, the game will kick off Sunday around 5:30 p.m. You can catch it on TV, or you can listen to it here on 104.7 The Cave at the part of the Midwest Family Stations. But it's the Kansas City Chiefs, San Francisco 49ers, live from Las Vegas. Of course, that'll be preceded by 7 to 8 hours of non-essential analysis and overpriced TV commercials, but we'll get to the game around 5:30. We'll deliver my prediction on this game in my Scott's Thoughts segment later in this pod. It's a big weekend for the Missouri State basketball Bears and Lady Bears. The Bears are suddenly hot again, taking an impressive 4-game win streak into a midweek game at Northern Iowa as we're taping this podcast. They're trying to stay in the thick of things in the Valley Conference standings. Kind of in the middle of the pack right now. They've played their way back in there, and they're trying to avoid the play-in round of Arch Madness in St. Louis early next month. Dana Ford's Bears are 14-9 overall going into that Northern Iowa game, 6-6 in the Valley, and conference frontrunner Indiana State comes into Springfield on Saturday for a visit to Great Southern Bank Arena in a 1 p.m. tip-off. That'll be a great matchup and a great test for these Bears, the way they've been playing. It's a very good Sycamores team already with 20 wins and really a good shot at being an at-large invite to March Madness if they don't win the Valley Tournament and get the automatic entry. Also, a huge weekend at home for the Lady Bears as two teams at or near the top of the Valley standings, Belmont and Murray State, visit the Vault this weekend. Friday night, it's Belmont coming in. They're 16-5 overall, tied at the top of the league standings with Drake at 9-1. They were an 11-point winner over the Lady Bears back on January 26th when Missouri State lost on the road on the same swing of Belmont and Murray State. Murray State will bring records of 13-6 and 6-4 into their Friday night matchup at SIU before they come to town on Sunday at 2 o'clock tip on Super Bowl Sunday. Coach Beth Cunningham's Lady Bears are 14-5 overall, 8-2 in the Valley, and a perfect 10-0 at home this season. That last number will receive a stiff test with Friday night's visit from Belmont in particular.
Around the Ozarks Sports Scene, brought to you by Fast Break Sports, the largest selection of cards and card supplies in Southwest Missouri.
Our special guest this week on Around the Ozarks Sports Scene is Dr. Heath Melugin, of course, a former Missouri State and Kickapoo soccer standout, All-American at Missouri State, who chose to go into sports orthopedics and medicine. He is now Dr. Melugin at Cox Hospitals. Heath, thanks for joining me.
Yeah, it's great to be with you, man. It's been really cool to see what you've done with this podcast.
Well, thanks. I appreciate that. And of course, my first question is, athlete all your life, what made you want to go into this field and take care of athletes and everybody else?
Yeah, so, that's exactly right. I mean, I would say the first half of my life to this point was absolutely focused on athletics. Whenever I got close to college, I was around some local orthopedic surgeons, one of them who happens to be my partner now, Pierre Clodio, and I developed an interest in medicine, and I saw that these orthopedic surgeons got the opportunity to work with athletes. When I got to Missouri State, I was further around those athletes and those doctors that were taking care of myself and my teammates. And, the interest grew, and luckily I've been able to pursue that.
And, of course, after Missouri State, went to KU for your postgraduate and number one in your class there. Are you a Jayhawks fan because of that time or not?
So I was born in Kansas, and a lot of my family is from Kansas. We kind of grew up Jayhawk fans. My younger sister played soccer at KU for 5 years. So I am a Jayhawk fan. It was a good game last night between KU and K-State.
And you've got basketball.
Wasn't good for us, but yeah.
Oh, yeah, absolutely. That rivalry's special, too. Went on from Kansas to the Mayo Clinic, and then also out in Vail, Colorado, at the Stedman Clinic, two pretty prestigious places to learn and practice your craft before you got after it full time back in Springfield.
Oh, that's exactly right. So I felt very blessed to go to first Mayo Clinic, and when I was there, I got to take care of some of the best athletes in the world. We helped take care of the Minnesota Timberwolves and the Minnesota Twins, and within orthopedic surgery, there's multiple different specialties you can go into. And I looked at some of those other specialties, including spine or hand surgery. But ultimately, I really enjoyed being around the athletes. So ultimately decided to go and specialize in sports medicine, which then I got the opportunity to go out to Stedman Clinic in Vail, Colorado, and specifically focus a year doing what's called sports medicine type surgery, which typically involves minimally invasive type surgery with arthroscopies, so tiny poke holes or reconstructing ligaments. And again, out there, got to take care of world-class athletes, which is a great experience.
And we're going to talk a lot about athletes and specifically youth sports here over the next few minutes, but I like your bio says you specialize in shoulders, hips, knees, and elbows. As a 60-year-old man, I know these are the things on a body that start hurting about this time. So any tips for older folks like me to maybe avoid those pitfalls of the pain that come with those areas?
Well, the biggest thing for all of us as we age is to keep up our core strength. So if you can do, obviously starts with the heart and cardio, but also you got to keep your core strong. As we age, the lower back really can become an issue for a lot of people. So keeping the core strong, keeping the weight down are the biggest things that are going to help prevent progression of, for example, arthritis, whether it be in your knees, your hips, or your shoulders, and just kind of prevent some of those ailing issues that, unfortunately plague us all as we age.
What's the most common among the older patients you see in terms of reconstructive surgeries? Is it which one of those joints or areas do you do most of?
Well, when you're talking about arthritis, the most common area of arthritis that we do surgery for is definitely within the knees. Mm-hmm. So we know that the knees essentially take about 4 times force of your body weight. So, obesity is an issue, obviously all around the world, certainly where we live, and the knees really, do work overtime to carry the body weight. So we see a lot of knee osteoarthritis, and ultimately when it gets to a certain stage, a knee replacement is really our only option. When we talk about kind of sports medicine type surgery, where we're fixing things within our body that fail, one very common injury that we see in older individuals is a rotator cuff tear. So in the shoulder, you have 4 rotator cuff muscles, and it's very common if someone happens to fall, for example, that recent ice storm we had, try to catch themselves, they can tear one of their rotator cuff muscles in their shoulder, and I find that I do a lot of surgery fixing those.
Or golf, guys that have played golf for 30 or 40 years, those things, when they get in their late 60s, 70s, they get a little more tender and fragile too, don't they?
Oh, that's exactly right. So we have, I take care of a lot of, local golfers, and things I see with them oftentimes, again, shoulder issues. So it might be a labral tear or some biceps tendonitis, or again, a rotator cuff tear. Or at the elbow, a common issue is golfer's elbow, which is related to pain on the inside part of your elbow, or tennis elbow, which is on the outside part of the elbow.
Well, let's talk youth sports and some of the, this is great for me, a guy that's been around sports, writing about it or talking about it for about 40 years, to have a sports doc on with me and be able to just fire questions away that I've always wondered, whether I'm sitting home watching TV or at a game and see something happen. And I think one of the hot topics now with youth sports, as a dad who's had 4 of them go through it, you see a lot of specialization now. Kids playing one sport year round instead of the multi-sport athlete that maybe plays football in the fall, basketball in the winter, baseball, or runs track in the spring, soccer mixed in all those seasons. What are your thoughts on specialization and what you see happening with youth sports in that regard?
Well, definitely what I see is there's such a pressure for these young athletes to focus on a certain sport much earlier than I feel like I had the pressure to do whenever I was going through it, and your kids, of course, Scott, as well. And, I think without a doubt there are some concerns with that. Now, I think it a little bit depends on the sport. In general, you hear a lot of physicians and people out there saying sports specialization is a problem. In my mind, I think it really has to do with certain sports. And one we talk about a lot with this is baseball. Mm-hmm. And, and I'm not sure it's really baseball that's the problem. For example, if you specialize as an outfielder, I think that's less of an issue for an athlete who is specializing in baseball and is a pitcher. Because really what we worry about is just the repetitive movements that are placed on the body that you're doing over and over and over. But without a doubt, I mean, if you look at, most of the best athletes we have, and you learn a little bit about their upbringing, most of them played multiple sports, until they got closer to that college age. And I think that is certainly the most advisable. But, there's major pressure on these kids, at an early age to really focus on one sport, which, is something we have to consider.
And that's coming from the parents largely because they're thinking, well, if our little Johnny's not doing it and Tommy's playing baseball or practicing year round, we're falling behind, is it not?
Oh, it absolutely is. And as a parent of young kids, I understand where the parents are coming from. And, it's definitely a balance. But I think if we can more and more just tell parents that, there are issues not only with physical injuries, but, there's a mental aspect to it too. And I think I see it in a lot of athletes that take care of, that you can tell they're just burnt out on their craft. And, playing different sports in different seasons does help prevent that.
There's a lot of information out there now, a lot more than there was 10 years ago about overuse. And it seems like youth baseball is trying to do a better job with pitch count, mandates and things of that nature. And of course, breaking balls and the stress that it puts on an elbow. Your thoughts on that? What's too young of an age to start messing around with a curveball?
Yeah, the curveball is an interesting debate because, a lot of us think, whenever you're trying to throw a breaking ball, it would seem as though you're putting more stress on the elbow. The interesting thing, Scott, we did a study when I was at Mayo Clinic, and that's not necessarily the case. So actually, a young athlete throwing a fastball puts more stress on the medial side of the elbow, which is where the UCL is, which we hear about Tommy John injuries. Mm-hmm. But there's also, a faction out there that really thinks we should avoid, those breaking balls in young athletes. So it's still a little bit up for debate. But I think when it really comes down to it, it's really all about pitch count. And I think we have to just control how many pitches these athletes are throwing. And, it's easy to find, obviously. I think Major League Baseball on their website has kind of the recommended pitch count for these athletes. The other thing to consider is, there was actually a study done which looked at pitchers who also catch. Mm-hmm. So a lot of people think, okay, we're going to control the pitch count. And, a lot of times in youth, the best athletes are pitching, of course, because they're bigger and stronger. And then whenever they take their break or they hit their pitch count mark, they go to catcher. But the problem is, as a catcher, you're still throwing the ball back to the pitcher each time as well. So that's something that we have to consider at the youth level.
And either that or they're going to play shortstop where they've got that deep throw in the hole where most balls are hit, and stuff to the shortstop.
Exactly.
So wasn't there an old school thought that the more you throw, the stronger your arm gets? That kind of defeats that whole premise, doesn't it?
It really does. I mean, as with most things in life, we tend to think the more you do, the stronger you're going to get, and the faster you're going to throw or the stronger you're going to be. The problem is what we see in a lot of these young pitchers, and like you said, I think the awareness is getting better on this, but the data would suggest that we're not necessarily getting better at it. So the injuries are continuing to go up. But the problem is when these young pitchers pitch a lot, they start having a little bit of pain in their elbow. And it's, again, with the mantra that I grew up with, you push through the pain. And most of these young athletes want to push through the pain, or they aren't telling their parents, or they tell their parents, and the parents are telling them you can get through that. And then they have an injury that really sets them back. And with these young athletes, having some of these elbow issues early on truly can end the career that they maybe could have had if they just took it a little bit slower.
And by the flip side of that, too, and it's pretty alarming, I think, is that, you'll see a pitcher that has Tommy John surgery and comes back, the proverbial air quote, stronger than ever. And I just wonder if there's a line of thought out there with some of the more aggressive baseball dads that, well, let's get it out of the way and we'll come back and we'll be fine. What are your thoughts on that?
Yeah, it's funny. Some of the guys I trained under who were kind of first around whenever Frank Jobe developed kind of the Tommy John surgery. And, of course, Tommy John was the pitcher at that time who came back and really came back stronger, throwing harder. And there were many professional pitchers who were going to their doctor, did not have an injury, but were requesting a Tommy John reconstruction because they've seen how other athletes came back stronger and faster. And I think that, certainly sometimes that can be the case, but with all surgery, and especially this type of surgery, there's a certain percentage that is not the case, and they don't get back. And, that risk is not one that we would recommend taking, without a doubt. And I think there's also, it's different having that surgery as an adult or a college baseball player than it is having it, as an early teen.
One of the things that amazes me, and I think back to what you do with older adults, I know my mom had hip surgery years ago before her passing, and, probably 20, 25 years, and the recovery was just long and pretty brutal. And then, my mother-in-law had it, and she was up like the next day, and just the technology and the way we can recover now. And I think back, or think now to football injuries and Tommy John surgeries and things like that. Now, I know the professional athletes want to push the limit. I mean, Brett Favre, whoops, he wouldn't like that. Aaron Rodgers with the torn Achilles and trying to come back so quickly and stuff. Has technology helped speed up the recovery process pretty much across the board?
It really has. As with all things, that we're blessed with living in the United States, is innovation. And we work within orthopedics very closely with these companies that develop new devices, help us discover new ways to do surgery. And without a doubt, we saw it with Aaron Rodgers. Some of the new ways we have to repair, for example, an Achilles tendon rupture, do allow us to kind of ramp up the process and get athletes back faster. We've seen that significantly, for example, with Tommy John type surgery. Mm-hmm. There's a company called Ozarks who developed this device, which is really high strength suture, and we call it an internal brace, which we use in the elbow, that honestly we can get athletes back much, much quicker.
Yeah, because that used to be like a year and a half, didn't it, at one point?
That's exactly right.
Yeah.
And then you saw Bryce Harper this past year return in about 6 months.
Yeah.
Where we did a UCL repair with an internal brace, And I've done that for some local athletes that have gotten back much quicker than, for example, with a reconstruction, a year-long process. And, the reality is Aaron Rodgers was never going to get back this season. Mm-hmm. But even the fact that he could have potentially, work towards that goal is an example of innovation. But I think what they were kind of pushing this year was a little unrealistic, which, we ultimately saw in the end.
I watched Kyler Murray come back from his Achilles and run around like the Kyler Murray of old, and it's just amazing. The guy was out with a torn Achilles and back the next season doing the same thing. So It's pretty remarkable. Next question. Get this a lot. What is too young to start lifting weights for young athletes?
That's a good question. I guess what I would say, kind of as I look at it with my kids, no athlete is the same, no kid is the same. So I think it depends a little bit. What we have to avoid is the obsession with kind of maxing out and pushing, these bodies to the max. It really goes back to the same thing we just talked about with sports specialization. What we want to avoid with these athletes is repetitive stress over and over on certain parts of their body. So I really like the idea, and I recommend to a lot of young athletes, is just do body weight type things, at least until you're in your teens. Push-ups, sit-ups. There's so much we can do without having to get necessarily in the gym and throwing around a bunch of weights. But I much prefer at a younger age, high repetition, low weight. And then as we get older, we can start pushing that weight a little bit more.
And I think that's why, places like Redline Athletics, the train youth like that are becoming more popular because it's people that know this and preach this, correct, when kids go out there?
That's correct. And, Scott, you asked me earlier about injury prevention in older individuals. It's the same thing for kids. As you're learning how to do new exercises, you have to learn correct form and the correct way to do it in order to get stronger and prevent injury. So Redline's done a fantastic job with it. All kinds of gyms in town, as anyone, whether it be a young individual or an older individual, wants to get in shape and get back in the gym, you got to learn the right way to do things first.
Tell me, why are ACL injuries more prevalent with young ladies than they are with men, seemingly?
Well, it's much more common in females. And so Mayo Clinic did a study looking at female soccer players, and it was kind of an astounding number. But after a female soccer player has had a torn ACL, their risk of re-injury to that knee or injury to the other knee is 34%, which is an extremely high number. There was some thought over time that it had to do with hormonal differences between males and females. That's been a little bit debunked. It has more to do with something we call the Q angle. So that is, if you take an angle going from your hips down to your kneecap, down to your ankle, females tend to have a little more of a valgus angle there, meaning they're a little bit more knock-kneed. And that is really the mechanism for a torn ACL. A lot of times it has to do with an athlete who jumps up, lands a little bit knock-kneed. They go into a valgus moment and a little bit of what we call a pivot shift, and then their ACL ruptures. So a major piece to preventing ACL injuries in female athletes is teaching them to land not knock-kneed, so meaning their knees closer together, but more straight on. And there's been some really good data to suggest that teaching young female athletes to land appropriately, strengthening their glutes, quads, and hamstrings can really prevent ACL injuries.
When I see high school football game and I see Jackson Cantwell at Nixa, who's just got a phenomenal future ahead of him at 6'8", 300 pounds, and number one recruit in the country in 26. He's got knee braces on, and so do other linemen before they've had an injury. Do those help?
Well, so what they help with, Scott, is MCL injuries. So those functional knee braces, the data is pretty clear that they do help prevent in linemen an injury to the medial collateral ligament. There's been no data to suggest that they prevent an ACL injury, but I think they can give some of these athletes more confidence when they're wearing it and feel a little safer. So there may be a mental aspect to it, but they've definitely been shown to help prevent injury to the MCL.
When you watch a pro football game or a college game and you see the guys with their pants now that basically look like shorts, they're finishing above the knee. Does that make you wonder, did the knee pads ever really help anyway with the guys that like us that used to wear the longer pants when we played?
I think most likely not. They may have prevented a skinned knee, but a lot of those things probably didn't really, help too much. And there's a lot of things we do. We've seen all through COVID and everything else that sometimes it seems like a good idea, but when we really look at the data, maybe it's not helping as much.
Another football question, equipment-wise, we see these helmets now with the padding on the outside, it looks like, and I know there's some high schools locally that are using them. A lot of attention paid to concussions and concussion protocol. Do those helmets help?
Yeah, I think there's been pretty good data around it. There's actually some decent. Have you seen the kind of necklaces that some of the athletes are wearing?
Yeah.
And there's actually some decent data around those as well. I think I saw one practice where Christian McCaffrey was actually wearing it. And what they can do, what those are thought to do, is actually increase pressure within the skull and the brain, to where there's less room for the brain to kind of move around or shake, which ultimately causes a concussion. I think that's one of the biggest problems that, whenever I was growing up and playing athletics, we just played through concussion type symptoms. But luckily there's much more of an awareness around that. And I think we've made some great strides in that arena.
So when you sit down and watch a football game with your dad, Phil, or your wife, Kelsey, or anybody, do you watch the game differently than other fans? I mean, if somebody gets hit, are you saying, ooh, that's a concussion, or ooh, that's an ACL? I mean, can you spot things, or are you thinking like a fan or a doctor?
When I'm watching the Chiefs, I'm thinking like a fan. Other games, without a doubt, you're always watching those types of things. And, I believe it was here recently, one of the Lions, I believe, tight ends had a bad knee injury. And you just look at the mechanism for how their knee got injured and the angle with which it went. And, we do spend time, trying to predict what injury did they have. When I was out at Stedman Clinic, I trained under Matt Preventure, who used to be the team physician for the Patriots when they won all their Super Bowls, and now kind of helps out with some analysis for Fox Sports. And when I was out there, we spent a lot of time kind of reviewing some of the injuries that occurred over the weekend and kind of making an educated guess as to what they're actually dealing with.
Are you a fantasy football player?
I was a terrible fantasy football player. I did it a little bit, kind of through college and residency, but I was the guy, unfortunately, that forgot to put in a kicker when that team had a bye week. So I don't do it anymore. Lost too much money doing it, Scott.
Well, the reason I ask is I'm in a league with a guy that may be a car dealer in town that you might have fixed a knee recently. And if you're supplying information to him in our league on this guy's only going to be gone for a couple weeks instead of 6, and that's illegal, and we don't want that to happen, okay?
I think I might know who you're talking about.
Yeah. Talking about football injuries, how in the world did Patrick Mahomes play a week later with a high ankle sprain? Because we've been trained in the fan world and the fantasy world that you hear high ankle sprain, it's 3 to 6 weeks probably minimum. How did Mahomes do that?
Well, how does he do anything he does, Scott? We see it with so many of these just elite athletes. Their bodies are just different. Now, for him, the reality is he was playing through pain. There's no doubt. There's no way he was 100% when he's out there. Now, I do think for him, he got something called a PRP, or platelet-rich plasma injection, which we do for a lot of athletes. And potentially, so essentially what that does is we draw the blood from the patient. It's spun down in a centrifuge to a high percentage of platelets, which have something called platelet-derived growth factor. And then we inject that back into an area of injury. And there's some data to suggest that it can increase and speed up healing. And he had that, as my understanding, which potentially helped. Past that, he was probably taking anti-inflammatories, and he probably paid for it the next day. But he's a competitor. He's an athlete. And you're right. I mean, most of the time, those high ankle sprains, I mean, it takes 6 weeks to heal from those.
Wow. So, if a mom comes to you, she's heard all the stories, she's seen the replays and all that, and says, I don't want my young son to play football. It's too dangerous. What is your response?
Well, in general, what I say is, you're right, it's dangerous. And in my mind, I don't really think there's any point for these young athletes to be tackling, before the age of 12. And, even at 13, 14, I think you have to ask yourself, what's the risk benefit to that? I think there's a big push in flag football, and I think that's a great alternative. But there's no doubt that the risk of injury in football and tackle football is extremely high. But I still think it's a great sport, and I think that if we can continue to find ways to make it safer, delay contact, tackle football until these young athletes are more mature, then I think it's a great American sport, and will continue to be very popular. But there's no doubt, I see it just in our town of Springfield. There's more and more athletes and parents pushing their kids to play a sport like soccer, or especially early on, rather than playing football early on.
Is football more dangerous than soccer?
I think there's more catastrophic type injuries. Mm-hmm. Now, if you just look at injuries across the board, soccer has a lot of injuries. But there's more major injuries in football. And I think tackle football, the micro trauma to the brain at an early age, in my opinion, isn't worth it.
I spent a lot of time, covering sports like soccer. And my time at Drury, I watched a lot of college soccer. And I just wondered, when the goalkeeper kicks it 60 yards and in the air and somebody heads it, back, which is a natural thing to do in soccer, is that not doing any damage?
Well, I think there's certainly risk within it. The interesting thing is we don't see many concussions from that, Scott.
Wow.
But what we do see concussions from is two athletes going up for a header, and then their heads colliding. So for some reason, when an athlete expects to do a header, I think there's an aspect of the body kind of preparing for that.
Kind of bracing.
Kind of bracing. The ball's not that hard. And, when I was growing up, there was kind of a push to wear these kind of protective head wraps for heading the ball. But really, the data didn't suggest that those increase safety at all. But when a soccer player gets hit in the head by another player because they're both going after the ball, it's an unexpected trauma, and a lot of concussions happen that way.
You're young in your career, obviously, back here in Springfield, and what do you foresee the next 5-10 years of youth sports injuries, kind of things that you'll deal with more often than not, seeing the current landscape of youth sports?
Yeah, so, obviously we've talked about baseball. I think we're trying to increase the awareness and decrease injuries related to overuse. So hopefully we continue to see these Tommy John type injuries, little league elbow, little league shoulder to decrease. We talked about ACL injuries in female athletes. The hope is that with some of these prevention strategies, we see less and less of those. But, with all these things, I hope that we continue to have kids who are active, playing real sports and not esports, Scott, which is a new thing that I'm becoming aware of. But it's without a doubt there's risk to playing sports. But I think when you look at the overall picture, it's better for young individuals to be active, staying in shape, and getting out there. We just hopefully continue to learn more about ways we can prevent injury.
Yeah, I see a line of carpal tunnel injuries coming on the esports side, with younger and younger.
But it's funny, we take care of the Jury Panthers, as you know, and they actually now have esport athletes, and we do physicals on those athletes, and I think there's going to be a lot more of those over the next 5-10 years.
Well, good stuff. Fascinating stuff, Heath. Always enjoy catching up with you. Hopefully we can do it again. I'll tell you what we've got to do, though, is if there's a procedure for Dr. Frank Jobe, named after Tommy John, Dr. James Andrews, we got to figure out what the Melugin is, the procedure. So next time I have you on, I want an answer on that, okay?
Well, we'll work on it, Scott, and I'll let you know. I'm not sure I'll ever achieve that status, but we'll work on it.
Very good. Well, I know you're on your way there, and so Heath, thanks for your time.
All right, thank you, Scott.
You betcha. Dr. Heath Melugin at Cox Hospitals, our new resident expert on sports injuries, and he is our sports doc. Thanks for joining us. Time for our weekly Scott's Thoughts, my musings and ramblings about the world of sports locally, regionally, and nationally. We start off with good news for the Kansas City Royals and their fans. They signed Bobby Witt, their young superstar shortstop, to a $288 million deal over 11 years on that contract, potential for even more years on that. Good move by the Royals, because if ever there was another potential George Brett type for their fans to follow, it's this kid, Witt Jr., or Junior as they call him on all the broadcasts and telecasts. Kudos to the Royals for spending some money and giving their fans a bright young star to rally behind for at least the next 7 years before his contract allows for an escape clause the next 4 seasons after that. With a new stadium downtown, a possibility, probably a likelihood, and some good young talent around Witt, maybe we'll witness a resurgence in the Royals the next few years. What a mess Coach Muss has created with Arkansas hoops down in Fayetteville this winter. It's easily his worst season at the U of A with a group that lacks chemistry and at times lacks any sense of motivation. That's what you get occasionally when you transfer portal, deep dive into the portal and take those gambles. Don't know what you're going to get. This time you got a lot of individual talent that just seem to not find a way to play together. And now they've allowed senior guard Devo Davis back on the team for a second straight year after taking a 2-week break for undisclosed reasons. He'll be back with his unpredictable, out-of-control style of play for a team that really doesn't need that right now, but hopefully maybe a little senior leadership, and maybe his emotional play will rally those guys down the stretch here. Their only chance for a return trip to the big dance is winning the SEC tournament and getting on a roll here late. If Musselman can pull that off, it's one of his best coaching jobs ever. Arkansas sitting there with 2 league wins, one of those over hapless Mizzou at the same time as well. This is from a team that showed so much promise in the preseason with a win over Purdue and then a late November home win over Duke. Things went awry, and we'll see if the Hogs can pull that back together. Finally, my Chiefs prediction. Kansas City wins a thriller 27-21 with a late interception of Brock Purdy to kill a Niners' potential game-winning drive in the closing minutes. It's only fitting that a very solid KC defense that literally kept them in playoff contention all season comes up with the big play in the end. Biggest shocker of all, Travis Kelce proposes to Taylor Swift in the post-game celebration and then announces that he will join brother Jason Kelce in retirement. The TV color commentator offers start flowing in on Monday for Travis Kelce. Be sure to visit our great sponsor, Fast Break Sports, on South Camel and Burger King this week to enter their raffle drawing for an autographed and framed Rashee Rice jersey that they'll give away at 5 p.m. on Sunday. There's no purchase necessary, and you don't have to be present to win, because the guys at Fast Break realize that you're going to be knee-deep in wings and cheese dip at 5 p.m. on Sunday. Also, remember that if you don't want to hear the national TV talking heads drone on Sunday night, turn the TV volume down and listen to the Chiefs broadcast on 104.7 The Cave, just like you can do all season and every season. That's going to do it for Around the Ozarks sports scene this week. Be sure to download the ATO app to listen to all the great local podcast offerings so you don't miss a thing when it comes to news and entertainment in the Ozarks. Thanks for listening. We'll see you next week.